All right, today we're jumping into something that's a really big deal in healthcare but doesn't always get the spotlight: pressure injuries. We're going to break down the two-part defense strategy that clinical teams use to protect patients from this totally preventable harm. Let's get right into it.
So here's our game plan. First, we'll get a handle on just how big this problem is. Then, we'll check out the tool they use to predict who's at risk, how a simple 4 eyes rule makes a huge difference, and finally, how they turn all that info into action.
First up, let's talk about why this is such a critical issue. The numbers we're about to see are, well, they're pretty staggering, to be honest.
Okay, get ready for this number. That's $26.8 billion. That's the estimated cost every single year to treat pressure injuries just in the US. It's a massive financial hit, mostly from people having to stay in the hospital longer for really complex treatments.
And here's the human side of it, which is even more important. More than 2.5 million people are affected by these injuries every year. So you can see this isn't some rare thing. It's a huge, widespread patient safety issue.
So what exactly is a pressure injury? You know, the easiest way to think about it is like a garden hose with a big rock sitting on it. The water just can't get through, right? It's kind of the same with your skin. When there's constant pressure, especially over a bony spot, it squeezes the tiny blood vessel shut. No blood flow means no oxygen, and the skin and tissue just start to break down.
This right here, this is the very first warning sign. It's called a stage 1. You see that red area? The key thing is that when you press on it, it doesn't turn white for a second. Go ahead, press on your own skin. See how it goes pale and then the color comes right back? When it stays red, that's a big red flag that the damage has already started under the surface.
Now, these injuries don't just happen anywhere. They have predictable hotspots, places where bone is super close to the skin. The number one spot, by far, is the sacrum, the tailbone area, from sitting or lying down. And right behind that are the heels.
Okay, so we know where they're most likely to happen, but the real question is, how can we figure out who is most at risk before anything bad happens? How do we see it coming? Well, the answer is a really powerful tool called the Braden scale. It was actually created by nurses for nurses way back in '87, and it's become the standard. I love this analogy for it. It's like a weather forecast for skin breakdown. It tells you when the conditions are just right for a storm to hit.
And the real genius of the Braden scale is that it looks at the whole picture, broken down into 6 key areas. For example, moisture is a big one, because skin that's always damp gets weak and breaks down easier. And nutrition is huge. Your body needs fuel, like protein, to keep your skin strong. Each of these is a vital piece of the risk puzzle.
So, a nurse gives a score for each of those 6 categories. Then they add them all up. Now, here is the most important thing to remember, because it's a little backwards. A lower total score means a higher risk. Let me say that again. Lower score, higher risk. It's super important. And those scores aren't just numbers on a page. They translate into really clear risk levels. So a patient isn't just at risk, they're at mild, moderate, high, or even severe risk. This forecast doesn't just predict rain, it tells us if it's going to be a light shower or a full-blown hurricane, which means we can prepare the right defenses.
But hey, a forecast is never enough on its own, is it? You also have to actually look out the window. You need a good ground inspection. And that's where the second part of our defense strategy comes in, the 4 eyes assessment.
And this isn't just some cutesy saying. It's a simple, incredibly powerful idea that's become a cornerstone for any hospital that's serious about preventing these injuries. It's all about teamwork and getting it right.
So what is it? A 4 eyes assessment is exactly what it sounds like. It's a standardized, head-to-toe skin check done together by 2 registered nurses, 2 RNs. The whole point is to have a second set of expert eyes to make sure absolutely nothing gets missed. And this isn't just a random spot check. It's done at very specific high-risk moments in a patient's stay. Right when they get admitted, anytime they get moved to a different unit, and when they come back from something like a surgery. It's all about catching things the moment they happen. So why the big deal about 2 nurses? Well, it does way more than just help find a red spot. It makes the assessment more accurate, for sure. But it also becomes this amazing moment for on-the-spot training and mentoring. And maybe most importantly, it creates this culture of shared responsibility. It's not just one person's job, it's everyone's job.
Okay, let's put it all together now. We've got our risk forecast from the Braden scale. We've got an on-the-ground inspection from the 4 eyes assessment. Now it's time to connect those dots and turn data into action.
The logic here is so simple and so powerful. If you find a high risk, either from a low Braden score or something you spot during the skin check, you don't wait. You act immediately. You launch a specific set of interventions designed to stop an injury in its tracks. And that plan of attack is super clear and focused. It really boils down to 3 critical actions, all designed to fight back against that constant pressure on the skin.
So what does that look like? It means actively turning and repositioning patients on a regular schedule. Think every couple of hours to give those hot spots a break. It means using special beds or cushions that are designed to spread out the pressure. And it means just good basic skincare, keeping it clean, dry, and moisturized to keep that natural barrier strong.
And this, right here, is the big takeaway. This is the whole game. When you combine that predictive tool, the Braden scale, with that collaborative check, the 4 eyes assessment, you completely flip the script. You stop waiting around to react to wounds, and you start proactively preventing them from ever happening in the first place.
And that leaves us with one last, kind of provocative question to think about. When we have proven evidence-based tools like these that we know can prevent this kind of harm so effectively, should getting to 0 pressure injuries just be a hopeful goal we aim for? Or should it be the absolute bare minimum expectation we have for patient care? Something to think about.